The surgeon may perform a fundoplication to treat gastroesophageal reflux disease or to repair a hiatus hernia. Digestion begins in the mouth as teeth break food into smaller pieces. Saliva releases digestive enzymes. When food is swallowed, it enters the esophagus, a long muscular tube that carries food from the mouth to the stomach for further digestion. Contractions called peristalsis push food down the esophagus. At the bottom of the esophagus, food passes through a muscular valve called the lower esophageal sphincter or LES and into the stomach. The digestive juices secreted by the stomach are highly acidic. When the stomach contracts to move the food into the intestine, the LES closes tightly in order to prevent these acidic juices from moving back into the esophagus, or it can cause damage. A breathing muscle called the diaphragm separates the chest from the abdomen. To reach the stomach, the esophagus passes through the diaphragm at a point called hiatus. In gastroesophageal reflux disease or GERD, the LES does not close properly, allowing acidic stomach contents to flow backwards into the esophagus. If GERD is not treated, it can lead to a variety of esophageal problems including ulcers, bleeding, strictures or narrowings, and Barrett's esophagus, which is the abnormal growth of intestinal type cells in the esophagus that can lead to cancer. In hiatus hernia, a portion of the stomach protrudes into the chest cavity through the opening in the diaphragm. A hiatus hernia can affect the LES and increase the risk and severity of GERD. During a fundoplication, the surgeon will begin by making an 8-inch incision in the abdomen to expose the stomach and lower esophagus. After separating it from nearby structures, the surgeon will wrap the fundus or upper part of the stomach around the lower esophagus and stitch it into place. This wrap acts as a belt which tightens and strengthens the LES. In the laparoscopic procedure, the surgeon will begin by making 5 small keyhole incisions, each about 1/2 inch long in the abdomen. Through one incision, the surgeon will insert the laparoscope, which is a long thin tube equipped with a light and a camera. The camera sends images to a video screen for the surgeon to view. Gas will be pumped in to inflate the abdomen to enable the surgeon to see the internal organs more clearly. Through the other incisions, the surgeon will use instruments to detach the fundus of the stomach from its surroundings, wrap it around the lower esophagus and stitch it into place. In case of a hiatus hernia, the surgeon will pull the herniated parts of the stomach back into place in the abdomen and tighten the hiatus ring in the diaphragm to prevent another hernia. This can be done through either an open or laparoscopic procedure. To complete the surgery, the abdominal incisions are closed with stitches or staples.